Action.
Hello, everyone. My name is Ron Nichols. I'm the director of Chambers County EMS in Chambers County, Texas. We're a small rural EMS service, cover about 980 square miles. So a little bit of my history. I've been in EMS for over 20 years. Prior to that, I was a Marine for 6. Did multiple tours in different areas. Was actually in one of the first units deployed to Afghanistan, northern Afghanistan, right after 9/11. And so one of the common things we've done that I've done, my history, I struggle with PTSD and depression. So I've got a history of PTSD and depression. I've been hospitalized for it, on multiple medications for it. Thankfully, with the help of multiple different people that were looking out for me, I am in a much better place and off of all of that stuff. So one of the things that I've always been a very strong proponent of in EMS, especially as administrator, is taking care of our medics, taking care of our firefighters, and make sure we're treating the mental health side of things just like we do everything else. So we've been using data to do that. So I apologize, I can't be there today. I'm on COVID quarantine, yay, in my office by myself. So it's entertaining. But so
well, we're with you in spirit, Ron. We're with you. We're with you in spirit.
Yeah. So a few numbers, just kind of give you an idea. So approximately 1 in 5 adults experience some type of mental illness every single year. About 1 in 25 actually have some serious mental illness, which could be, limiting one or more of their major life activities. About 18% of adults in the U.S. are going to experience some type of anxiety disorder, whether it be PTSD, obsessive compulsive disorder, or psychosis. One thing you'll notice in most of my slides, and you'll hear me talking about it, we call it post-traumatic stress or acute stress syndrome. I don't like using PTSD because I don't believe PTS is actually a disorder. I just think it's a mental thing that we can all work through at some point. So if I don't add the D in, that's why. So about 50% of adults experience some type of substance use disorder or living with mental illness. And the third most common cause of hospitalization in America for adults between the age of 18 and 44 is some type of mood disorder. So major depression, bipolar disorder, things of that nature. 18 to 22 veterans every day commit suicide. That's something I also do, veteran suicide awareness hotlines, and work on call for that and try and prevent that as much as possible. And then with first responder suicide, this has been a big topic since about 2017, yet we still don't have the statistics to get accurate numbers, because only about 40% of the time is it actually reported to the appropriate channels that they were a first responder and related to the suicide. So where did some of these numbers come from? So in 2015, Florida State University did a study of 1,027 firefighters. And there's been some other studies that follow up, but they don't have as many as good data. But 46% of responders report suicide ideation or thoughts of actually having suicide. 19% of responders reported having had plans of death or suicide. About 15% have reported that they actually attempted death by suicide, and 16% have reported having inflicted non-suicidal self-injuries. There's other studies out there too that can give you some more numbers in response to first responder suicide. And the IAFF did a large study and put out some details in 2017, and that's where we did some of our program from. So a few things that we can do to help. So number one, we have protocols and checklists. We have clinical guidelines. We have all of those things for everything that we do in EMS as a whole. Fire departments, EMS, as first responders, your sheriff's officers and police officers have checklists they go through every morning before they start on duty. So why don't we have the same thing for occupational stress and mental health awareness? So that's one of the things that we need to look into doing. Do the trauma screening questionnaire. So after about 2 to 3 weeks after you have a major incident, there's a little questionnaire you can fill out. It'll be provided in the slides, and we can provide you more documentation later. Have the medics or the firefighter fill it out. If they score 6 or higher on that quiz, and it's just some simple questions, but if they score 6 or higher, we need to make sure we get them some type of mental health and force them to go see somebody or talk to somebody through an EAP program or something that effect. Try and transition from the standard EAP programs. I can attest because I used them when I was going through my major struggles back in 2012, 2013. I was having some major issues. And I contacted the city's EAP program and actually made the therapist cry on the other end because they're not experienced with dealing with what we deal with as first responders. So try and transition away from some of your EAP programs and start finding some behavioral health assistance programs with some clinicians that have exposure and know how to deal with first responders. Make sure you give those guys all the extra effort they're going to need. And then the big thing is do hot wash post incidents. Anything that you think might be a trigger for those medics, do a quick hot wash with them, whether it be through Microsoft Forms or in person, doesn't matter. So why does this stuff kind of matter and how do we kind of track that? So on average, a system with, let's say 10,000 calls annually, they'll have an average of 50% of those calls are going to be a potentially traumatic event and can cause some PTSD. So a PTE can occur in a 20-year career first responders or in a new recruit. So it doesn't matter. It just depends on how they're affected. So some of the things you want to utilize to figure out that data when you're creating your guidelines is use your dispositions that you have that you use on a daily basis for your QA/QI process. So cardiac arrest or arrest, any pediatric call, right? Any major trauma call, anything that would be considered a sentinel event when you're doing normal QA/QI review. All those things will help you kind of figure out what those calls we need to do the hot washes on and which ones we need to follow up for. So
how are you describing a sentinel event specifically?
So a sentinel event is going to be anything that would be flagged in your system. So, for us, a sentinel event would be all of our priority 1 and priority 2 calls we consider sentinel events. They're not sentinel events, but they get the level 1 QA/QI. A sentinel event would be the patient died, whether it was your fault, whether it was prior to arrival, that's a sentinel event. Anything where you have maybe a major clinical issue on a call, that would be considered that can be considered a sentinel event. But what we found is some of those sentinel events, we look back on them and we start reviewing them after the fact. And yeah, there was mistakes made, but maybe the mistake was made because once you dig into it a little bit further, we found this 3 times in the last 2 months, to give you an idea. Had a sentinel event, had a patient where the outcome wasn't as good as it should have been. After doing interviews with the medic and trying to figure out what happened, realized that that medic related that patient to their grandmother, or that medic related that patient to their brother or sister. And so when that happens in our head, we can't always focus on what we're doing. So that's why anything that's a sentinel event, make sure you flag that so that you can review that and make sure it's not something to do with the PTS on the back end. The checklist for your mental health awareness program, ours is called the Resiliency for Total Wellness. And it's actually incorporated into our county wellness program, which includes our physical health screenings as well. So we have a check sheet for post-incident hot wash, as well as the trauma screening questionnaire. The medics, when they do the post-incident hot wash, our county has a program through the wellness program where they get wellness points. So if they're seeing a mental health professional or using our employee assistance program that's designed for our first responders, they actually get additional wellness points to go towards that. So that's something we've incorporated into it to encourage them to do it more. So on your surveys, things of that nature. So everything we do in EMS, as soon as we're done with the call, we do a PCR. We do our primary care report, right? So build your surveys into your PCR system. Your hot wash checklist sheets can be built into your PCR question. Your trauma screening questionnaire can be a survey that you send in on the back end, or any other check sheet that you're utilizing for the mental health awareness, and build them into it. And then create your analytic reports so that you can track that data and monitor your results. Whichever PCR system you're using gives you access to generate your own reports and how you want to track those. So was the screening done? If it was done, did we have improvement from when we started the program to 6 months later and we're doing the trauma screening questionnaires and we have less likely of a result to send somebody to get additional treatment, right? That's all data that you can track and that we track on a regular basis. So for our system, in the last 6.5 to 8 months, we've seen an overall increase in the morale, as well as a reduction in PTS and ATS symptoms since instituting the program in July of 2020. Especially in the last 6 months of this year with the recent spike in COVID, it made a huge difference. We actually increased our billables by almost triple during that instance, which is okay because I budgeted for it. That's what it's there for. But as far as the medics getting and seeing their therapists and things of that nature, so that's actually helped overall increase the morale and increase productivity in the EMS system. So that's just a quick breakdown. I wish I was there to answer more questions. Hopefully I'll be able to do that with you guys. at the end of this, and I'll be able to do it virtually. But if you have any questions, Jonathan will provide you my email address and my cell phone number. It's on 24 hours a day, 7 days a week. You can attest to that. You guys are welcome to call me if you have any questions.